So in the last class we are discussing about omitting, and we have seen the causes of omitting, and we have seen the different approaches of the omitting and different complications, red flag signs of the omitting in newborn, and different causes of omitting according to age. All these points we have already covered in the previous classes. So today we will in short look into the treatment of omitting, and before that yes, we will go to the treatment of the omitting now. Very important thing is reassuring the patient. Okay, many times the omitting is actually not omitting, it is regurgitation, and we need to reassure the parents that this is not omitting, this is simple regurgitation. There may be some faulty feeding habits or improper way of the feeding, and that is the cause, so we have to correct it most of the time, especially in neonates. And always whenever the mother comes with the omitting that my child is omitting, so a single episode of omitting never need a treatment. We have to understand the omitting can occur any time because of various causes. If it is one or two episodes are there, or even one episode or at least two episodes are there, and then there is no omitting, so this actually does not require much treatment. Only persistent omitting requires the treatment. Therefore omitting should not be over treated. Okay, and we know that even in Ayurveda it is told that Vamana is considered under Adharaniya Vegas. Vamana should not be suppressed, isn't it? We know that it is the stomach don't want to keep that particular metal, therefore it is putting it out. So this is one of the natural body protective reflex. Okay, so na Veghana Dharayadvata Vinmutra Kshavatrukshatam Jumba Shwatrama Shwasa Chardi. So there is Chardi is considered as one of the Adharaniya Vega. So it should not be dharana. If it is going out, it's very good. Even Kashyapa says, Vagbhata says that, I think it is in Bhavaprakash or something, where he says that the child who is omitting always, so he will be devoid of Kaphaja Rogas. Okay, a child who is having frequent omitting will never suffer from Kaphaja Rogas. So this particular statement is also given in Ayurveda. So therefore, a newborn child or infant child, whenever there is one or two episodes of vomiting, it should not be over treated. Rather, we have to give the rest. The things will be get corrected by itself. But only if the red flag signs are present, we have to be a little cautious. Okay. Now, what is very important is to find out the cause, and we have to treat it. You should not blindly treat it. First, find out the cause. Whether faulty feeding habit is the problem, or the mother is giving the feed in the lying down position, or mother is not burping, or sealing is not proper. Okay, so or baby is over crying. Okay, only after baby crying the mother is giving the feed. This is also one of the cause. Or mother is overfeeding the child. So such you find out the cause of the vomiting, and then only you treat. Blindly you do not treat the vomiting. That's the one thing. Sometimes mother also complains that whenever I give the feed, child used to vomit out. So that time you have to correct the way of feeding. Ask the mother to not load the things at once and give in sips. Most of the time I will say instead of going for a spoon, even you go to use a dropper. In the newborn baby, give drop by drop. So when you give in bulk, there is every chance that baby may get vomit. Then anti-emetic drugs like in the contemporary medical science, we know that ondansetron, etc. is given now. Okay. So of course we will not comment on that. That's another drug. MSET is another important drug which is commonly used. So these drugs are available. Now we can see what actually in Ayurveda we can give for the omitting, childhood omitting. Okay, so one of the best way for the omitting is you give some of the drugs which are having a strong aromatic smell. Strong aromatic smell. Any drug, maybe ela, maybe methi. So such that means fragrant, those drugs which are outbursting the fragrant smell. So that is one of the best anti-emetic actually. Okay, and to some extent, many times Amla Rasadravyas are also considered to be anti-emetic. Many times we can use, most of the time we also use, whenever the baby is vomiting, we just make the baby to lick the lemon piece. Okay, so that is also reflectively acting as an anti-emetic most of the time. And one of the best drugs that we will have is, which is also used for hika, that is Mayura Pichabhasma. Mayura Pichabhasma can be also effectively used. Okay, 1 or 2 pinches of Mayura Pichabhasma is also very good. Anti-emetic. Although it is mentioned for hika, it is also an anti-emetic. Now, whenever the child is vomiting, you go for Pratimarga Haranaya Vachikata. That means you just go for mild virechana drugs like Avipattika Churna. Okay, so now actually the child is having vomiting, means the peristaltic movement is now directed upwards, isn't it? So once you give Avipattika Churna, so that redirect the peristaltic movement and it is towards the downwards, and as a result, the child may have one or two increase the frequency of that means loose stools or stool, but vomiting will subside. A simple method. Okay, so because gastric emptying will be facilitated. So these are some of the common medicines that we can give. Then find out some of the common causes of vomiting, like overfeeding is the cause, because we know that the stomach capacity is only 30 ml in a term baby at the time of the birth, and the gastroesophageal sphincter is not an anatomical sphincter, it is a physiological sphincter. So these 2 points we have to keep in mind accordingly, and we have to give the feed and take all the cautions. Otherwise, there will be regurgitation. Then exaggerated gastroesophageal sphincter. Exaggerated gastroesophageal reflux is one of the most common cause of newborn vomiting, as we have already discussed, because that sphincter itself is physiological, it is not much mature, and it is highly sensitive for any type of stimulations. So always give the small amount of the feed frequently and then go for burping. So that's very important. Another important cause for the vomiting in the newborn is faulty breastfeeding habits. Most 90% of the time this is the cause. We have to correct this only actually. Okay, improper sealing, and then comes we know that we have already discussed the air enter inside and get collected on the upper side. Okay, another one is positioning of the baby. Positioning of the baby during the time of the breastfeeding and after breastfeeding. Okay, always keep the baby after breastfeeding in the right lateral or left lateral position. That is quite beneficial. Okay, so whenever you keep the baby in the prone position, so every chance vomiting chances will be more. So that's usually preferred is left lateral. Okay, so these are some of the important precautions that you have to take. Slides are moving.
No, sir.
Okay, so now we will discuss some of the important case. Okay, so case study is very important. Through the case we can understand many of the problems very easily. Okay, these are some of the live cases. Okay, now a 3-week-old infant is there and it is presented with vomiting for last 4 days. This is a complaint of the mother. The child is 3-week-old. 3-week-old child is, it's not child, it is infant, rather newborn. 3-week-old infant you can call. Okay, presented with the vomiting. Usually we cannot call it as infant because infant is after 1 month. So this is only 3-week-old baby. So this is a late neonate. So 3-week-old late neonate presented with the vomiting for last 4 days. Mother complaint is since last 4 days he is vomiting. Okay, and according to mother he is vomiting for 4 to 6 times per day and often after the feed. This is a complaint of the mother. After the feed usually he will go into vomit. Mother is telling that vomitus contains the milk which is curdled and it is not green. You further inquire the mother what is the color of the vomitus. So mother says that fata hua hai, doodh fata hua doodh aata hai. Okay, so vomitus contains the milk which is curdled. Wahan curd ban gaya hua actually, because after going to the stomach it come in contact with the hydrochloric acid. So there the milk will go into curdle. Okay, and it is not having any green color or reddish color, blood, etc. And there is also infrequent stool since last 1 week. This is what mother is telling. He is also passing the stools. Okay, stools में जो है बहुत बार करता है, दस्त जैसा लग रहा है और लैट्रिन में बहुत बार करता है. Okay, so there is also infrequent stool since last 1 week. All these problems started since last 1 week. Okay, now baby is taking the exclusive breast milk. Baby is not taking anything from the outside. Only mother is feeding. Okay. And you have seen on physical examination there is some distension of the upper abdomen. In the upper abdomen there is some distension. Now these are the findings. Okay, it is a 3-week-old baby and there is frequent vomiting. There is also frequent stool passing also. Vomitus is curdled, contains the curdled milk, and slight abdominal distension is there. And now we have to look into the presentation. What may be the cause for this particular vomiting and what is your opinion? The first thing what we have to do here is we have to do a DD between omitting and as well as regurgitation. You have to make it confirm whether it is regurgitation or whether it is omitting. We know the difference. Omitting means forceful expulsion will be there, it will fall forward. Okay, regurgitation is just oozing. Okay, so just slipping of the dribbling of the contents. Now, again, the cause is same. The immaturity of the cardiac sphincter may be the common cause for regurgitation, while omitting carries many causes. If it is really omitting, we know how the omitting occurs. Okay, there are so many changes taking place, abdominal muscle contract and all those things. So if it is omitting, there are many causes. Okay, there are many DD. First DD that we have to do it with regurgitation. If it is regurgitation, we have got only a few causes. If it is omitting, then we have got a lot of causes. Okay, we have to see one by one. But here what mother is telling that the milk is curdled. Okay, milk जो है फटा हुआ है, and we know that when the milk enters into the stomach, okay, that means milk is curdled means milk जो है हाइड्रोक्लोरिक एसिड का कांटेक्ट में आ गया है. मतलब आप जो दूध पिला रहे हैं वो स्टोमक में जा रहा है. दैट मीन्स यहाँ पे अपर रेस्पिरेटरी ट्रैक्ट में या अपर जीएटी में कहीं पे भी कोई ऑब्स्ट्रक्शन नहीं है. देयर इज नो प्रॉब्लम इन द फेरिंग्स एरिया, देयर इज नो प्रॉब्लम इन द इसोफेगस एरिया, एंड देयर इज नो प्रॉब्लम एनीवेयर टिल स्टोमक. So because your milk is reaching to the stomach, that means up to that extent there is no any obstruction or any problems. Okay, so milk is comfortably reaching the stomach, therefore it is get curdled. नहीं तो वो कैसे फटा हुआ है. ठीक है. So milk comes in contact with the acids which are present in the stomach and as a result it's converted into curd. Okay, for this conversion it has to stay for now this is another point. Now milk is reaching the stomach, no doubt in this case. Now वहाँ पे वो रीच होने के बाद क्या हुआ है, यहाँ पे फटा हुआ है. फटने के लिए वो कर्डलिंग हुआ, तो एक्चुअली वहाँ पे कुछ देर मिल्क को रुकना पड़ेगा तभी जाके उसका कर्डलिंग होगा, है ना, तुरंत तो नहीं होगा. ओके, सो इफ इट इज curdled, that suggests that milk has been stored in the stomach for some time. Okay, so usually whatever abdominal food contents you take, so gastric emptying time बोल के है ना, half an hour to 1 hour gastric emptying time is there. So usually milk is stored there. Any food material which is given stored in the stomach for some time, then it moves forwards. So here also the milk is stored in the stomach. Okay, stored in the stomach for some time. So problem is in the stomach, not above the stomach. There is no problem related to esophagus because sometimes achalasia, cardiac problem is there, esophagitis हो सकता है, बहुत सारे problems है. Okay, but all such problems are not in this case as milk is comfortably reaching the stomach and also getting curdled. Okay, now what is your conclusion? So conclusion is very simple. Problem is also now, so it is not above the stomach. Stomach में problem है. प्रॉब्लम स्टोमक से बिलो भी नहीं है ना, स्टोमक से नीचे भी नहीं है प्रॉब्लम, बिकॉज इफ द प्रॉब्लम इज बिलो द स्टोमक ओमिटस शुड बी बाइल मिक्सड, इजंट इट. बाइल मिक्स होना चाहिए, बट यहाँ पे बाइल मिक्स नहीं है, सिर्फ दूध पटा हुआ है. सो प्रॉब्लम इज नॉट बिलो द स्टोमक ऑल्सो बिकॉज ओमिटस इज अ नॉन बिलियस, इट इज नॉट बाइल मिक्सड. सो मीन्स पैथोलॉजी इज नॉट बिलो द सेकेंड पार्ट ऑफ द ड्यूओडेनम. सो दिस इज स्टोमक टू पाइलोरिक स्टेनोसिस तक इसका प्रॉब्लम चल रहा है. ओके, सो बाइल जूस एंटर्स द इंटेस्टाइन एट द मिडल ऑफ द सेकंड पार्ट ऑफ द ड्यूओडेनम पोस्टीरियरली, वी नो दैट. सो एनाटॉमी इज वेरी क्लियर. सो एनाटॉमी इज नॉट अप टू द not above the stomach and even not below the stomach. Below the stomach means not below the second part of the duodenum. So there is also infrequent stools. इस केस में मदर इज ऑल्सो कंप्लेनिंग ऑफ इनफ्रीक्वेंट स्टूल्स. बच्चा जो है उसका स्टूल का फ्रीक्वेंसी भी बढ़ा हुआ है. दैट इज ऑल्सो सिंस लास्ट 1 वीक. सिंस लास्ट 1 वीक स्टूल का फ्रीक्वेंसी भी बढ़ा हुआ है. नाउ द क्वेश्चन अगेन कम्स अप. इन सम इन्फेंट्स स्टूल now what mother is telling that even there is an increased frequency of the stool also. Now usually normal infant even pass up to 15 to 20 times of stools, and we know that is because of the gastrocolic reflex. Okay, so some infants may even pass up to 15 to 20 times. That is also considered as normal. But here mother is telling that infrequent stools are there, then 3-week-old infant, it may be normal, isn't it? It may be normal gastrocolic reflex also. it is frequently passing. So it suggests that mucosa is not able to completely absorb the lactose of the breast milk. So due to laxative action, it is passed. Now, okay. So दो possibility है. Whenever the baby is passing frequent stools, especially in the first few parts of the first few days of the life, one is, as we know, it's a gastrocolic reflex. Whenever any food comes into the stomach, suddenly there is stimulation of the peristaltic movement, and that is carried through the intestine, and whatever content is there, that will be evacuated. One problem. Another one is, as the breast milk comes, as the breast milk contains more and more lactose, it's a sugar, and sugar is always a osmotic laxative. And if the child is not able to tolerate or digest or metabolize this particular lactose, as intestine is immature and it's not able to produce a lactase enzyme, to some extent, because of the osmotic laxative action also, the stool frequency may be increased. Okay. So these are the two possibilities are there now. So when constipated, it suggests that baby is completely absorbing the breast milk and there is no residues formed. Therefore, most of the time mother also comes with a constipation. My baby is not passed the stool for 3 days, 4 days. So this is quite common in the newborn baby, because there is nothing like that in the breast milk which is left as residue. Okay, everything will be absorbed from the breast milk. Very less amount of the stool is formed. Therefore, the constipation is quite common in the newborn baby, and there is no need to worry and give any medicines. Okay, and so now, in this case, if you see again, the problem comes now what to decide about these infrequent stools. Okay, there is also vomiting and there is also infrequent stool. Now comes the problem. But main criteria in both cases are normal if the baby should gain the weight normally. Now, what is very important is, do you think it is physiological? Like that, what I am telling, the stool frequency is increased. There may be two causes. One may be because of the gastrocolic reflex, and one may be another cause where the lactase is not completely metabolized to some extent, and mucosa is immature. But in both the cases, actually what happens is there is no problem for the weight gain actually. Okay, weight gain will be normal. Okay. Now there is also vomiting and there is also infrequent stool passing. So in between these two, there is only one part, that is a pyloric part. Now if you see, first part is vomiting, isn't it? Vomiting is because of the stomach cause. Second complaint is infrequent stool. The stool is something related to, what you say, the intestine. That is, diarrhea is something related to intestine and colon. Now between the stomach and between the intestine, there is one part is there. What is that? That is pyloric part. Pyloric sphincter is there. Okay, so when there is only vomiting, it is quite sure that is stomach. When there is only diarrhea is there, definitely it is the intestine. But now there is vomiting and diarrhea, both are there without any fever and all those things. So what is the only part which is remaining in between? In between the part is only pyloric part. Okay, so now we can come to a conclusion that there may be some problem related to the pyloric part. Some problem related to the pyloric. Why? Because, see, in this case, if it would have been a case of a regurgitation, or if it is faulty feeding technique, then the problem would have been started from the day 1 itself or day 2 itself. Isn't it? If it is gastrocolic reflex, that problem would have been started maximum by 1 or 2 days when the breastfeeding starts. But here, actually, if you see the case, the problem started 1 week back. The vomiting started about 4 days back. And the frequent stools, increase the frequency of the stool started 1 week back. Okay, now this is the problem. So, although it looks like that a simple faulty breastfeeding may be the cause for the vomiting in this case, but when you go very in detail way or systematic way, you find that if it is really such a problems, normal physiological problems, it have been started from the birth itself. But suddenly after 15 days or 3rd week of the life, these problems are started 4 days back. Okay, when the baby is almost 15 days old, the problem started. So now we have to think otherwise. So there is also diarrhea, there is also vomiting. In between, the only part which comes, that is pyloric part. So there may be some problem related to pyloric part of the stomach. We shall see. We don't know. We will see. Now, in between these two, there is only one part, that is pyloric part, and this should be the case of a congenital pyloric stenosis. Therefore, this is a case of congenital pyloric stenosis. Now, the question may be asked, if it is congenital pyloric stenosis for the first 15 days, why there is no any symptoms? Only after 15 days the problem started, isn't it? Now, the answer is there. Now we have to go for some of the examinations. In the examination, what they are telling is, there is a distension of the abdomen, especially in the upper part of the abdomen. In the upper part of the abdomen, there is some abdominal distension. So they are telling that. So upper part of the abdomen means it is epigastric area. So they are telling clearly that there is some olive fruit-like shaped sized swelling is there usually, which is seen in case of congenital pyloric stenosis. Okay, and there is also visible peristalsis. Okay, there is also visible peristalsis, and there is a swelling, and that was told by the mother. Some swelling is there in the abdominal part. Okay, or distension is there in the abdominal part. That's also in the upper abdomen. So this particular finding suggests that, so this may be a case of congenital pyloric stenosis. Now, in case of congenital pyloric stenosis, if you see the peristalsis, this is in the stomach. Therefore, peristaltic movement will be always from left to right. Left to right. In the colon, it is from right to left. In the intestine, it is step ladder pattern, or just ladder pattern, not step ladder, ladder pattern. Okay, so visible peristalsis. Okay, now how to see the visible peristalsis? It's very simple. You just give any stimulation to the abdomen. Okay, जैसा pinch करते हो, ऐसा कुछ करो abdomen में, tickling करो. So then this peristalsis will begin. Okay, so now after all this discussion, what helped us is the systematic analysis of the symptoms. है ना, हम ऐसे उसको जनरली नहीं लिया कि वोमिटिंग हो रहा है, ठीक है ये हो सकता है, ठीक है। मदर का हर कंप्लेंट को हमने सुना, मदर बता रही कि यहाँ पे सबसे इंपॉर्टेंट क्लू हमारे लिए क्या है कि ये 15 दिन के बाद क्यों शुरू हुआ। अगर ये सब कुछ नॉर्मल है तो पहले दिन से होना चाहिए था, बट ये 15 दिन के बाद शुरू हुआ, तो डेफिनेटली कुछ है यहाँ पे। ओके, सो नाउ क्वेश्चन इज, if it is congenital pyloric stenosis, why it is not started from the birth itself? Usually congenital pyloric stenosis में, so it will not okay, that we will discuss. Okay, if the condition is congenital, suppose ये congenital, ये आपका भी क्वेश्चन होगा, सबका क्वेश्चन है, if it is congenital, then why it took about 3 weeks to start with the presentation, है ना, 15 दिन तक कुछ नहीं, उसके बाद क्यों शुरू हुआ? कॉन्जेनिटल है, पाइलोरिक स्टेनोसिस एरिया है, वहाँ पे स्टेनोसिस से ऑब्स्ट्रक्शन है, तो मैक्सिमम 3 या 4 दिन के बाद शुरू हो जाना था उसको, बट इट इज़ नॉट लाइक दैट, 15 डेज के बाद शुरू हुआ, ठीक है। और इवन स्टूल पैटर्न भी चेंज हुआ 15 दिन के बाद, और ये भी जो है वोमिटिंग भी 15 दिन के बाद हुआ। नाउ सी, दिस इज स्टेनोसिस, यहाँ पे क्या हो रहा है, कॉन्जेनिटल पाइलोरिक स्टेनोसिस, एंड इट इज नॉट एट्रेसिया। एट्रेसिया क्या हुआ है कि बना ही नहीं है, पूरा का पूरा बंद है। ये क्या है, स्टेनोसिस है। स्टेनोसिस का मतलब है थोड़ा बहुत गैप है वहाँ पे, ठीक है। इट इज नॉट कंप्लीट स्टेनोसिस, थोड़ा बहुत तो गैप रहता है। देयर इज अ डिफरेंस बिटवीन एट्रेसिया एंड स्टेनोसिस। बाइलियरी एट्रेसिया पूरा बाइल डक्ट पूरा ब्लॉक है, वहाँ पे एक ड्रॉप भी नहीं जा सकता है। ओके, सो इट इज नॉट मेड इटसेल्फ, नॉट फॉर्म्ड इटसेल्फ, एट्रेसिया। But this is stenosis. Things are formed normally. Pyloric canal is formed normally, but it's narrow. The lumen is less. Okay, that's the problem. So in atresia there is a complete blockage, as occur in case of duodenal atresia, biliary atresia, etc. Okay, but in this case it is stenosis. Okay, stenosis means थोड़ा बहुत गैप रहता है, उसमें चीजें चलता रहता है। mitral stenosis आपको पता है। Now when breast milk come and start storing there, है ना, 70% वो ब्लॉक हो चुका है, वहाँ पे 30% ओपन है, तो वहाँ पे ब्रेस्ट मिल्क आया, वहाँ पे स्टोर होना शुरू हो गया। एंड देन देयर इज अ फर्मेंटेशन ऑफ द लैक्टोज, तो स्टोर हो गया वहीं पे, तो वहीं पे HCl भी है, तो उसके साथ पूरा मिक्स हो गया। मिक्स होने के बाद कर्डलिंग होना शुरू हो गया। ओके, एंड देयर इज फॉर्मेशन ऑफ लॉट ऑफ लैक्टोज। सो लैक्टोज तो है ही है, तो लैक्टोज अंडरगो फर्मेंटेशन, तो लॉट ऑफ केमिकल्स आर प्रोड्यूस्ड। सो इसके बाद क्या हुआ कि फर्मेंटेशन हो गया, तो लॉट ऑफ एसिडिक सब्सटेंस आर प्रोड्यूस्ड, केमिकल्स आर प्रोड्यूस्ड, वी नो दैट। ओके, CO2 एंड ऑल दोस थिंग्स। नाउ लॉट ऑफ केमिकल्स आर प्रोड्यूस्ड एंड स्लोली देयर इज कंस्ट्रक्शन ऑफ द म्यूकोसा बिकॉज ऑफ दिस acidic substances which are, or chemicals which are produced, that now causes constriction of the muscles of the pyloric stenosis. Okay, and the partial obstruction is now almost all get converted into complete obstruction. So for this to happen it took 15 days. ये होने के लिए वो 15 दिन लिया। Okay, so this is very important. Okay, congenital pyloric stenosis means it's not completely, there is nothing is there, complete blockage is not there, partial blockage is there. Okay, of course only 30% is open, 70% is closed because of this hypertrophied मसल्स बट वो 30% भी क्लोज हो जाता है बाद में, जब वहाँ पे आएगा, स्टोर होगा, फर्मेंटेशन होगा, फर्मेंटेशन होगा तो केमिकल्स बनेगा, वो केमिकल्स जो है मसल्स के ऊपर एक्ट करेगा, इट कंस्ट्रक्ट द मसल्स एंड कॉज द कंप्लीट ऑब्स्ट्रक्शन. Okay, so for this it took about 15 days. So this is the reason why it took 15 days. So now when there is complete obstruction, the proceeds that there will be a presentation of the congenital pyloric stenosis. So first 3 weeks the baby is quite normal, और उसके बाद complete obstruction होते जो है typical congenital pyloric stenosis का symptoms आना शुरू हो गया. Okay, now, so usually the first child male is affected more. There is an incidence, congenital pyloric stenosis में, usually the incidence shows that the first child is having more chance and male child is having more chance. ठीक है, exact reason why it is happening nobody knows. First child में congenital pyloric stenosis होने का chances ज़्यादा होता है और male child में congenital pyloric stenosis होने का chances ज़्यादा होता है. Okay. Now, throughout the case if you see, what is the main clue in this case? The main clue जो है, आपको लग रहा था कि ये सिंपल फॉल्टी फीडिंग हैबिट्स है, आपको लग रहा था कि ये गैस्ट्रोकोलिक रिफ्लेक्स है ना, शुरू में तो ऐसे ही लगता होगा, बट कुछ और ही निकला ये. ठीक है, द मेन क्लू जो है हमने इसमें आइडेंटिफाई किया, दैट इज चेंज इन द पैटर्न ऑफ द स्टूल. ओके, इफ देयर इज ओनली वोमिटिंग, यस एवरीबडी विल गो टू कंफ्यूज, बट देयर इज ऑल्सो चेंज इन द पैटर्न ऑफ द स्टूल. वोमिटिंग के साथ साथ स्टूल का पैटर्न भी चेंज हो गया, बिकॉज 3 weeks back the stool was normal. मदर क्या बोल रही है, तीन वीक पहले बच्चे का सब कुछ नॉर्मल था. अगर रियली वो गैस्ट्रोकोलिक रिफ्लेक्स है तो बच्चे को फर्स्ट या सेकंड डे से ही प्रॉब्लम शुरू होना था. प्रॉब्लम नहीं है जो चीज़ें होना चाहिए, क्योंकि वो तो नॉर्मल है गैस्ट्रोकोलिक रिफ्लेक्स, बट ऐसा नहीं हुआ. आफ्टर 3 weeks इट स्टार्टेड. ओके, वोमिटिंग ऑल्सो इट स्टार्टेड आफ्टर 3 weeks. ओके, सो बट देयर इज ए सडन चेंज इन द स्टूल पैटर्न आफ्टर 3 weeks. So why this is happening? Because of due to obstruction, the milk is not reaching the intestine at all. Okay, there is some obstruction, so milk is not reaching the intestine at all, and as a result, there is change in the obstruction, change in the stool pattern. And this is a case of congenital pyloric stenosis, and you can see this is thickened. जो pyloric part है. This is the pyloric part which is get thickened over here. Okay, so this is pyloric part which is get thickened here, you can see. So but it is not completely closed. See, it is not completely closed. Okay, it has got a small opening here, stenosed part is there. Now in the second picture, if you see this one is the epigastric swelling which is seen over here. Okay, so epigastric area में ये जो swelling आपका pyloric area में आएगा ना, तो एपिगैस्ट्रिक एरिया में जो है ये स्वेलिंग आ रहा है, ऑलिव शेप्ड स्वेलिंग. ओके, एंड अनदर इज दिस इज ऑल्सो ए स्कीमेटिक रिप्रेजेंटेशन हियर ऑल्सो. सो व्हाट एग्जैक्टली हैपेंस, डियोडिनम पाइलोरिक स्टेनोसिस, सी it is converted into a narrow tube-like structure, and this is actually a child with the pyloric stenosis, and some peristalsis can be also seen here. Of course, ये तो still picture है, इसमें तो नहीं होगा. So this is the case of pyloric stenosis, and we should not be get confused with the simple vomiting or simple gastrocolic reflex or gastroesophageal reflex. So what is important is, if it is gastrocolic reflex or gastroesophageal reflex, it have been started from the beginning itself. But here suddenly a normal child started with this presentation, that is always abnormal, and therefore it should be looked for. So this is the case number 1 regarding vomiting that we have to understand. So congenital pyloric stenosis is not uncommon, it is quite common. Therefore in the general practice, clinical practice, we have to be quite careful. Okay, of course the treatment is surgical treatment, we know that Ramstead operation has to be done. Okay, we have to longitudinally, we have to give an incision there so that muscles undergo relaxation. So so that's all about the first case.